Total shoulder arthroplasty is when you replace a joint, the ball and socket joint of the shoulder in this instance. This is a procedure for patients which are in pain with a limited function, and therefore you want to allow a smooth and a pain-free movement. What you do is resurfacing or indeed replacing the humeral head and the socket with metal and plastic. There are three types of replacement: hemiarthroplasty, when you replace half of the joint; total shoulder arthroplasty, when you replace both the ball and the socket joint; and the reverse total shoulder arthroplasty, when you reverse the ball and socket joint to compensate for lack of tendon function, muscular function. A good candidate for a shoulder replacement is usually an elderly patient with limited function and severe pain who is struggling to cope with day-to-day activities and sees his quality of life jeopardized by the pathology. There are different problems around the shoulder which could lead to a replacement, and therefore different type of implants, as we previously mentioned. Another factor is the age. So depending on the age of the patient, you opt for one type of implant or the other. Obviously, the younger the patient is, the less invasive you want to be. So for example, for very young patients, let's say in their 40s or 50s, a hemiarthroplasty where you only change half of the joint is what you most likely, if possible, look to perform. This is mainly in the view of future revision surgery, because obviously the younger you are, and the most likely is that the shoulder will require further operation, and so more bone preserving or less invasive implants will help future revision surgeries. There are different conditions in the shoulder world that could lead to the need of shoulder arthroplasty. The two most common ones are osteoarthritis of the shoulder, so wear and tear of the joint, and wear and tear of the tendons, so which is called cuff tear arthropathy, which means that you can develop arthritic shoulder due to the lack of tendons and due to the lack of control of the muscles around the shoulder. Most likely for the first type of pathology, you want to replace the ball and socket anatomically, because you can still rely on the muscles and the tendons for the function and the movement. In the other pathology where you don't have the muscles to move the shoulder, you need to opt for a reverse to the shoulder arthroplasty, which is a semi-constrained implant which allows the deltoid to take over the rotator cuff and allows the patient to mobilize despite there is no injury in the shoulder. There are other conditions like fractures, for instance, or fracture sequela, or vascular necrosis, which can all be treated with an arthroplasty if needed. But the main key concept is that if there is a good preserved rotator cuff, you can replace the shoulder anatomically, maintaining the ball and socket where they are. If there is no injury because the rotator cuff is failed, either for the genetic condition or trauma, you need to reverse the ball and socket joint. Shoulder arthroplasty surgery involves an admission to hospital where you have your operation, which usually lasts an hour and a half, depending on the condition and the complexity of the case. The procedure is done under general anesthetic, so you'll be asleep throughout your operation, and you'll have a nerve block, which means an injection in your neck to numb your nerves, so that your hand and arm goes numb and you don't feel pain for the first 24 hours. You'll have good analgesia to go home with, and your arm will be put in a sling to support it for the first few days after surgery. You can go home the following day after surgery, but you can also go home the same day if the anesthetists and obviously myself as a surgeon are happy that you'll be safe to go home within 24 hours, and there are no major comorbidities and major problems seen for you to do so. The recovery for shoulder arthroplasty depends a lot on the type of implant you have, and also depending on the surgeon preferences. In my practice, I keep patients for anatomic total shoulder or hemiarthroplasty, where the patient still relies on the rotator cuff for function, 4 weeks in a sling, because you need to wait for the rotator cuff to heal before you can start mobilizing. Obviously, you'll be encouraged to move the elbow, the wrist, to avoid stiffness of joints which are not affected by any pathology, and also some basic exercises to keep the shoulder mobile, but you won't have any formal physiotherapy. In case of a reverse to the shoulder arthroplasty, for me, there is no restriction. You can start moving the shoulder day one, only the pain will stop you perhaps to do too much too soon. But because it's got intrinsic stability, you can start using it for eating, drinking, getting dressed within the first week. I know from, being published about this in the past years, and I know still today there are many centers where they keep even reverse to the shoulder mobilized for 3 or 6 weeks. So depending where you are, you might see different way of rehabbing your shoulders. Shoulder arthroplasty longevity depends on the type of implant chosen. Anatomic replacement, obviously divided in hemiarthroplasty and total shoulder. The weak links could be the rotator cuff, which can be affected by degeneration anyway, even a normal shoulder, so that can fail. And if you talk about a total shoulder where you replace the socket side as well, you can have a failure of the glenoid side. So, we're talking about probably 10-15 years of longevity of these implants. Obviously, the next step after an anatomic total shoulder is to convert it to a reverse total shoulder. So revision surgery is often needed in these cases. If you consider instead a reverse total shoulder, these are semi-constrained stable implants, and so despite there has been papers published with increased risk or complication in the first few years following a reverse to the shoulder compared to an anatomic, long term they do perform better and they last a long time, probably more around 20 years. Obviously, these implants have been around for probably 20-25 years, so they're relatively recent, so longer follow-up is needed, but the new design, the new models coming up, the results are very promising. In fact, you might see that more and more surgeons and disease in many countries all around the world and move from doing anatomic to do reverses, if it's possible, in many cases.